Salmonellosis, the hidden danger in poultry farms. This presentation is divided into 4 segments. In the first segment, we present the importance of salmonellosis as a foodborne disease. The second segment discusses Salmonella infection in chickens. During the third part of our presentation, Dr. Ali Muhammad offers our subscribers with a lecture about the etiology and diagnosis of poultry salmonella. At the end of this video, we offer our viewers with a summary of salmonellosis in poultry. Now, let's begin with our presentation.
Salmonella is a foodborne illness that can be caused by eating raw or undercooked poultry. There are over 1 million cases of salmonellosis in the United States annually, and the CDC estimates that salmonellosis causes 22,000 hospitalizations and 450 deaths.
The following are some of the causes of salmonella infection in poultry. Unsanitary conditions in poultry farms. Contamination of feed with infected chickens. Contaminated water used to wash hands or equipment. Ducks, wild birds, rodents, or other animals on the farm that carry the bacteria. It is essential to take certain precautions when handling poultry or cooking them to prevent salmonellosis. One of these precautions is to wash hands after handling raw poultry and before touching anything else. In addition, prevention of salmonella includes cooking food thoroughly before ingesting it. Now let's discuss salmonellosis infection in poultry. Salmonellosis is also known as fowl typhoid. The clinical signs are yellow color diarrhea, anemia, and pale comb and wattle. Salmonellosis in poultry is caused by Salmonella gallinarum. Salmonella gallinarum is a gram-negative, non-motile, and non-sporing forming bacteria. Chicken is mainly affected but can occur in turkey, guinea fowl, ducks, parrots, and wild birds. This disease has a worldwide occurrence in non-commercial poultry. The morbidity varies from 10 to 100%. The mortality in the poultry farm ranges from 4 to 50%. Horizontal and vertical modes of transmission characterize poultry salmonellosis. The horizontal form includes bird droppings, contaminated fomites, and vectors. The vertical form has a transovarian route, where the eggs are infected. The clinical signs of salmonellosis in poultry are the following: ruffled feathers, rapid respiration, inappetence, thirst, pale color comb and wattle, yellow diarrhea, and reluctance to move. During the post-mortem examination, we would notice the following findings: bronze color enlarged liver, congested with necrotic foci, swollen spleen, enlarged kidneys, nodular masses on the myocardium, and the inflamed ovarian follicle in laying hen. The diagnosis of salmonella infection in chickens can be obtained by the clinical signs, a post-mortem examination, and the isolation and identification of Salmonella pylori via PCR, ELISA, and agglutination tests. The prevention of salmonellosis in poultry can be obtained by strict biosecurity measures, culling of infected and carriers birds, proper sanitation in farm premises, and control of wild birds and rodents in the poultry farm. In the following section of this video, Dr. Ali Muhammad gives us a lecture about salmonellosis in chickens.
I'm going to discuss with you people about a very important and famous clinical case on the side of poultry. It is basically the topic of poultry pathology. We are going to discuss it into 3 parts. It is basically about the Salmonella infection of the poultry. Okay? So we are going to discuss it into 3 parts. In the first part, we are going to discuss about the Poultry disease. In the second part, we are going to discuss about the fowl typhoid. And the third part and the last part, we are closing it with the paratyphoid. So first of all, we are going to discuss about the Poultry disease. Okay. So to start with, it is Poultry disease. It is also called as bacillary white diarrhea. It is an acute, highly contagious disease of the young chicks up to 3 weeks of the age. It is characterized by septicemia, white diarrhea, respiratory distress syndrome. High morbidity rate is observed, about 10 to 80%, and up to 100% mortality rate has been observed. So it can be so much dangerous for your chicks. In adults, if we talk about adults, the infection is localized and chronic form and mainly in brown shell egg layers. Also, it infects the other birds like turkeys, guinea fowls, sparrows, parrots, ringdoves, ostriches, and peafowl. We talk about the etiology or the cause of the disease. It is infected by causative agent is Salmonella pylorum from the family Enterobacteriaceae. And if we talk about the general characteristics of the agent or the bacterium is gram-negative, rods found in rod forms with rounded ends. And the bacterium is non-motile, non-spore forming, and anaerobic. Here you can see the picture of Salmonella pylorum. If we talk about the transmission, there are two modes of transmission of this bacterium. Number one is horizontal transmission, and the second is the vertical transmission. We will discuss one by one both of them. If we talk about the horizontal transmission, the important points could be as follows. In case of horizontal transmission, it could be due to infected droppings. Means that the birds that are already infected, from the droppings of that birds, it could infect other birds. It could be transmitted through the contaminated feed and water, contaminated feed of water of those animals whose proteins and those animal proteins, especially in the match fields. So it can also be transmitted by Salmonella. So Salmonella can survive for 2 years in feed and at least 1 year in the dust in an empty poultry house. So you can see that it can survive for a large time in your feed, and in the empty poultry house, even in the dust of your empty poultry house. So control strategies should be implemented very carefully. It could also be transmitted by the contaminated poultry houses, contaminated incubators and hatcheries. Cannibalism could also be the transmissible source. Insects, including cockroaches, flies, beetles, can carry the Salmonella in and out of the farm. Mice and rats have been an important factor for this bacterium. Wild birds carry Salmonella, and contact with wild birds or their droppings is a risk factor for commercial poultry. Humans can also be a source of Salmonella transmissible to the poultry. If we talk about the vertical transmission of the Salmonella pylorum, we can discuss that it is transmitted from parents to the offspring through trans-ovarian mode of transmission. Here, the trans-ovarian mode of transmission has been shown in the figure. Infected hen lays the egg, and when this egg is hatched, the young one that comes out of the egg is also infected with the causative agent, the bacterium Salmonella pylorum. So this is the vertical transmission from adult to the offspring through trans-ovarian mode of transmission. 10 to 15% eggs produced by infected hen can carry the organism. So if a hen lays 100 eggs, 10 to 15 eggs out of those 100 eggs could be infected with the Salmonella pylorum. Salmonella carried in or on eggs can be spread extensively in the hatchery. As chicks or poultry peeps through the egg shells, Salmonella are released into the air and circulated around the hatching cabinets on contaminated fluff and other hatching debris. The newly hatched birds lacking protecting intestinal microflora are highly susceptible to the intestinal colonization of the Salmonella. Clinical signs. If you talk about the clinical signs in chicks as well as in adults, in case of chicks, the incubation period of the causative agent is 4 to 5 days. Large numbers of dead in-shell chicks, i.e. chicks that are in shell and are infected with the bacteria, or the chicks that die shortly after hatching, or that are associated with heavy losses that occur within 1 week of the hatching of the chicks. So if we see so many deaths in the new birds, you can assess that it could be due to Salmonella pylori. Loss of appetite and huddling together. Loss of appetite and huddling together by the new birds could also be the sign that from where we can assess that they could be affected with Salmonella pylori. Here we are going to talk about the very important clinical signs that are described in the following that are most important. Sagging of wings and distorted body appearance is very important clinical sign. Chalky white excreta or white diarrhea. Here you can see the bird is with sagging wings and the body appearance is also distorted and whitish diarrhea is also been seen. Bent pasting position could also be the clinical signs, and the animal is pot bellied. Here you can see the belly of the animal is swollen, is highly swelled, like in the form of a pot. The labored breathing or gasping could also be the clinical sign that could be observed in the chicks. If we talk about the adults exhibit little or no symptoms, but we can see the swollen hawk joint and poor growth in case of adults. We talk about the pathogenesis step by step. So first of all, the organisms enters by two modes, either by ingestion or either abrasions. After entry, it leads to the septicemia that could be manifested by severe enteritis in the birds, and the respiratory symptoms are also observed. There we can see the localization of the causative agent or bacteria in the GIT and sex organs also, and the transmission, vertical transmission will be observed from the infected mother to the offspring. If we talk about the pathogenesis, after ingestion, the organisms colonize the ileum and colon and invade the intestinal epithelium and proliferates within the epithelium and lymphoid follicles. The mechanism by which Salmonella invade the epithelium involves an initial binding to the specific receptors on the epithelial cell surface, followed by invasion. First it attacks and then it invades. It attaches to the epithelial surface. Invasion occurs by the organisms inducing the enterocyte membrane to undergo ruffling. After it is attached, it induces the enterocytic membrane, and the enterocytic membrane undergo ruffling, and thereby it stimulates the pinacocytosis of the organisms. Here the pinacocytosis phenomena has been shown. The causative in the form of blue it first attaches to the membrane or the enterocytic membrane, and after it stimulates after its binding, initial binding, the specific receptors are then stimulated. This results in the invasion of the causative agent, and the ruffling position of the enterocytic membrane is created, and soon after this, through the process of budding, it enters the enterocytic cells. After invading the epithelium, the organism multiply intracellularly and then spread to mesenteric lymph nodes and throughout the body via the systemic circulation. They are taken up by the reticuloendothelial cells. The reticuloendothelial system confines and controls the spread of the organisms. After invading the intestine, most Salmonella induce an acute inflammatory response which can cause ulceration. They may elaborate cytotoxins that inhibit the protein synthesis, and invasion of the mucosa causes the epithelial cells to synthesize and release various pro-inflammatory cytokines, including interleukin 1, interleukin 6, interleukin 8, T1 necrotic factor 2, T1, and other cytokines. These evoke an acute inflammatory response and may also be responsible for damage to the intestine. Because of the intestinal inflammatory reactions, symptoms of inflammation such as fever, chills, abdominal pain, leukocytosis, and diarrhea are common. Salmonella escape from the basal side of the epithelial cells into the lamina propria. Systemic spread of the organism can occur, giving rise to enteric fever. Invasion of the intestinal mucosa is followed by the activation of mucosal adenyl cyclase. The resultant increase in the cyclic adenosine monophosphate induces the secretion that results in the diarrhea. It may involve local production of prostaglandins or other components of the inflammatory reactions. In addition, Salmonella strains elaborate one or more enterotoxin-like substances which may stimulate intestinal secretion. This increased intestinal secretion, acute inflammation, ulceration, increased intestinal motility, and decreased feed digestion and absorption leads to the diarrhea. Here, the mechanism of the induction of the diarrhea has been elaborated in the form of flowchart to comprehend it. So, first of all, the organism is ingested. There is colonization of the lower intestine of the bacterium in ileum and cetium, and the mucosal invasion occurs. The cytotoxins are here stimulated. The cytotoxins then induce acute inflammation that results in ulceration, prostaglandin synthesis, enterotoxins, and cytokines. And all these stimulate the activation of adenyl cyclase, and resultant increase in the cyclic adenosine monophosphate occurs. This results in the fluid production, large and small bowel fluid production, that results in the diarrhea. Here, in the form of picture, it has been also elaborated to comprehend in more effectively and more easily. The Salmonella enters, first of all, it adheres here on the villi of the small intestine, and from there it is penetrated into the cells, enterocytes, and in the form of vacuole, and from here it is then it enters the deep tissue. It invades the deep tissue, and in the deep tissue it is engulfed or phagocytosed by the macrophages, and it results in the systemic dissemination through the diarrhea. Post-mortem lesions. In case of sudden death, we observe Salmonella pylorum through the post-mortem lesions seen in various organs of the organism. In case of liver, the liver is enlarged, congested and hemorrhagic. In case of systemic form, there we see the small areas of necrosis in the liver, heart and lungs. Intestinal or cecal inflammation and cecal cores are also seen. In case of chronic cases, there is yellowish or blood-stained yolk sacs, there is delayed yolk absorption, enlarged spleen and congested kidney has also been seen. There we see the thickened intestinal wall and peritonitis in the case of chronic cases, and abscess formation in the Hawk joint, necrotic foci, abscesses on cardiac muscles, liver, lungs and gizzards has also been seen. Common diagnostic lesions are unabsorbed yolk sac. You can diagnose the pylorum Salmonella from the lesions such as unabsorbed yolk sac, classic gray nodules in the liver, spleen, lungs, heart, gizzard and intestine. If we see these lesions, gray nodules, and then we can diagnose it as Salmonella pylorum. There we can see the firm cheesy material in the cecal cores. We can see raised plaques in the mucosa of the lower intestine. To continue the diagnosis, we can see typical lesions and gram-stained specimen examinations are also performed for the correct diagnosis. Isolation and identification of the organism is the first step. Samples are collected from the liver, spleen, heart, blood, ovary and yolk sac. In case of primary isolation, we perform two type of tests: brilliant green agar supplemented with sulfapyridine or mechanic agar, and the second one, colonies or transparent pink to deep fuscia around surrounded by reddish medium of the test is performed is observed. We also perform the second type, serological identification, to diagnose organism. In case of serological identification, we perform rapid serum plate test or tube agglutination test. In case of plate agglutination test, here are three pictures. This is the negative test. Show this. If the results are like this, it shows the negative test, and if the results are like this, it shows there it could be susceptible, and this is the pure positive test for the Salmonella. Differential diagnosis. We can see lesions on liver, lungs, heart, on in case of other causative agents also. So how can we differentially diagnose it, or what could be the other such cases? In case of liver lesions could resemble other Salmonella infections, so we should differentially diagnose it. Lung lesions could also resemble Aspergillus infections. Joint lesions could resemble Mycoplasma or Synovia infection. Pericardium and ovary lesions resemble coliform staphylococci and micrococci infection. So we really need to differentially diagnose it from all these other causative agents. So how can we control the disease? Following are some tips or methods. We should adopt good management, serological test of the flock and removal of the infected breed birds. Third one, proper sanitation and disinfection of the farm and premises, control of the rodents, focus on egg hygiene, proper hatchery sanitation, use of antibiotic ciprofloxacin could be the control measurements. Here are some pictures about the clinical signs that we can observe after death or in the live animal, but prepartum, not postpartum, both in case of postpartum and prepartum. So in prepartum case, we can observe the sagging of the wings in the distorted position. Here you can see the sagging of the wings and the distorted position, body appearance of the chicks. Here the bent testing position of the animal. Here in case of postpartum, we can see in the heart the nodules, nodular lesions. Here you can see all these nodular lesions. In case of lungs, it is the normal symmetry, coloration, texture of the lungs, but here you can see how the texture, color, body size, and you can see the nodules, large abscesses in the case of lungs, swellings of joints and synovitis, inflammation of synovial joint could be seen in the leg of the bird. Here is another picture. Here in the case of heart, you can see the nodular lesions. Oh yes, it is liver. You can see a lot of black nodules. These are all nodular lesions, and these are the confirmation of the Salmonella pyllurum. Here in the intestine, in the cecal course, in the duodenum, you can see the ulcerative and the nodular plaque-like accumulation. Here, here in the lungs, synovitis, and it is also a picture of lungs. So you can observe how the abnormalities can be seen in case of Salmonella pyllurum in the organs of the dead animal. So this was all about part 1 about Salmonella, and in the second part of the Salmonella we will discuss about another topic. So from till now, thank you for patience watching. Do subscribe to our channel and press the bell icon for such informative videos and lectures. For that time, goodbye, bye bye.
Now here is a summary of what we discussed in this presentation. Salmonella is a foodborne illness that can be caused by eating raw or undercooked poultry. There are over 1 million cases of salmonellosis in the United States annually, and the CDC estimates that salmonellosis causes 22,000 hospitalizations and 450 deaths. The following are some of the causes of Salmonella infection in poultry. Unsanitary conditions in poultry farms. Contamination of feed with infected chickens. Contaminated water used to wash hands or equipment. Ducks, wild birds, rodents, or other animals on the farm that carry the bacteria. It is essential to take certain precautions when handling poultry or cooking them to prevent salmonellosis. One of these precautions is to wash hands after handling raw poultry and before touching anything else. In addition, prevention of salmonella includes cooking food thoroughly before ingesting it. Fowl typhoid is another name for salmonellosis. Diarrhea of a yellow color, anemia and pale comb and wattle are all symptoms. Salmonella pyllurum causes salmonellosis in chickens. Salmonella gallinarum is a non-motile, gram-negative bacteria that do not produce spores. The disease primarily affects chickens, but it can also infect turkeys, guinea fowl, ducks, parrots, and wild birds. This illness is found in non-commercial poultry all around the world. Morbidity ranges from 10 to 100%. The chicken farm's mortality rate ranges from 4 to 50%. Poultry salmonellosis has both horizontal and vertical transmission mechanisms. Bird droppings, contaminated fomites, and vectors are all examples of the horizontal form. However, the eggs are infected by a transovarian pathway in the vertical form. Salmonellosis in poultry manifests itself in the following ways. Ruffled feathers, rapid respiration, inappetence, thirst, pale color, comb and wattle, yellow, diarrhea, reluctance to move, weakness. Ruffled feathers, rapid respiration, inappetence, thirst, pale color, comb and wattle, yellow, diarrhea, reluctance to move, weakness. We would observe the following findings during the post-mortem investigation. Expanded liver with necrotic foci of bronze hue, swollen spleen, enlarged kidneys, nodular masses on the heart, inflamed ovarian follicle in laying hen. Clinical symptoms, a post-mortem examination, and the isolation and identification of Salmonella pylori using PCR, ELISA, and agglutination tests can all be used to diagnose Salmonella infection in chickens. Strict biosecurity measures, culling of sick and carrier birds, good sanitation in farm premises, and control of wild birds and rodents in the poultry farm can help avoid salmonellosis. Veterinary channel. Poultry management. Salmonellosis, the hidden danger in poultry farms.